I'm Dr. Angela Edwards, the Medical Director for the Preoperative Assessment Clinic and an Assistant Professor in the Department of Anesthesiology. You and your doctor have decided you need surgery. You have chosen one of the finest facilities, Wake Forest University Baptist Medical Center, to have your procedure. Our staff will do everything we can to make you comfortable and ensure your quickest possible recovery. In the next few minutes, we'll cover two main topics: managing your pain following surgery and preventing other problems that could arise. We want you to have this information before your surgery so you will know what to expect and how you can take a more active role in your recovery. First, let's begin by talking about managing your pain after surgery. It is very important to all of us that you don't have much pain. We want your pain to be as controlled as possible. If your pain is under control after surgery, you are more likely to do the activities that will help speed your recovery. We will discuss these later in the course of this video. When most people think of pain relief, they think of medicine. However, there are other activities, such as reading or puzzles, that can distract you from thinking about your pain. The hospital also provides a relaxation channel on the in-house television, which can be very soothing. Techniques such as touch therapy or massage therapy can also help significantly decrease your pain. Let us know what methods may have helped you in the past to manage your pain. Your doctor may also prescribe pain medicine. We use several methods to give pain medicine. You might get your pain medicine through a very small plastic tube in a blood vessel, called an IV, through an even smaller tube in the space of your back, called an epidural, near a nerve, called a nerve block, or as a pill or capsule. We do not give pain shots anymore. Medicines given in IV or by epidural relieve pain quickly, although relief may not last very long. Pills take a little longer to begin to relieve pain, and relief can last from 3 to 4 hours and even up to 12 hours. With epidurals and nerve blocks, the pain medicine is in your body for as long as the tube remains in place, and the medicine is running through the tubing. If you still feel some pain, you may ask for extra pain medicine, which can be given through your IV or by mouth. Some patients may have a patient-controlled analgesia, or PCA pump, for approximately 2 or 3 days after surgery. With the PCA pump, the patient controls when the pain medicine is given. The main thing to remember is that only you, the patient, can push the button to get the medicine when needed. Press the button to get the medicine when the pain first begins. The PCA pump is set up with limits so that you get a correct, safe amount of medicine without significant risk of overdose. You play the most important role in managing your pain. Here are some important points for you to remember. Don't worry. Studies show it is rare to become addicted to pain medicine. If you take medicines only to control your pain, you will not likely become addicted. Ask your nurse what your pain medicines are and when you're able to take them. Ask your nurse if you will get pain medicine on a scheduled basis or if you need to ask the nurse to bring the medicine to you. Either you or a family member may want to write the time you take your medicine so you will know when you can have it again. Don't wait. Do not let your pain become too severe before you ask your nurse for your pain medicine. It is much harder to get rid of severe pain than it is to treat pain as it begins. Let's catch it early and keep it under control. Please continue to give your nurse feedback. It is important to tell your nurses and doctors what works, what doesn't work, and any side effects that you may be having. If one medicine does not work well, we can try another until your pain is controlled. When you begin taking pills or tablets, remember to take them with food to avoid nausea. Some pain medicines cause constipation. Drinking liquids, walking, and asking your doctor about taking a stool softener are options to relieve such symptoms. With your pain under better control, you can become a more active partner in your recovery and get the best results from your surgery. Some things only you can do to help prevent problems after surgery are as follows. Breathe deeply and cough to keep your lungs clear. Use a device called the incentives barometer, which also helps clear the lungs. Move around and get out of bed as soon as your doctor tells you it is okay. And tell us about your concerns or problems. After surgery, one of the first things your nurse will have you do is take deep breaths and cough. Remember, you can ask for your pain medicine before you do this exercise. It is very important that you breathe deep and cough often to move fluids out of your lungs to prevent pneumonia. To get the most from deep breathing and coughing, take a slow, deep breath. Put your hand on your abdomen, close your mouth and breathe in through your nose. As you breathe in, you should feel your abdomen rise as though trying to lift your hand. Practice this as you watch this section of the video. Breathe in through your nose slowly. Put your hand on your abdomen to see it rise. Breathe out slowly through your mouth. Breathe in and out 3 times. As you breathe out the 3rd time, cough forcefully. You need to feel the cough from the lower part of your chest. You are not clearing your lungs well if you're coughing from the upper chest or just clearing your throat. If you have an incision in your chest or abdomen, you can decrease the pain from deep breathing and coughing by firmly holding a rolled up blanket or pillow over your incision. To help clear your lungs, you will use a breathing device called the incentive spirometer. It imitates your body's natural way of yawning or sighing. It's a way to get you to take long, slow, deep breaths. You will use this device about every hour while you're awake. If you have the incentive spirometer with you, practice using it as you watch this section. Let's get started. Your nurse will set your target number. Your goal is to get the ball to that number. Sit up as straight as you can and try not to slouch. This gives your lungs more room in your chest. Hold the device up straight. Now let's go through how to use it. Breathe out through your mouth, not your nose. Put the mouthpiece in your mouth and close your lips tightly around the mouthpiece. Take a slow, deep breath through your mouth, not your nose, until your lungs feel full. Keep the flow rate guide, the blue ball, between the arrows to see how slowly you need to breathe. When you can't breathe in anymore, hold your breath about 6 seconds. For the 6 seconds, you can count quickly to yourself. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. Look at the volume indicator to see how close you are to your goal. If you can't reach your goal, don't give up. Keep trying to reach it. Then remove the mouthpiece and breathe out slowly. Rest 2 or 3 seconds and take 3 or 4 normal breaths. You will follow these steps 5 to 10 times each hour while you're awake. Breathe in, hold 6 seconds, and try to get to your target number. Then remove the mouthpiece and breathe out slowly. After you finish with the incentive spirometer, cough 2 to 3 times to clear your lungs. Spit out any mucus or sputum you cough up. If it hurts when you cough, hold a pillow or rolled up blanket firmly over your incision when you cough. Your breathing and coughing exercises are very important to keep parts of your lung from collapsing. Staff will ask you if you're doing your breathing exercises and will remind you to use your incentive spirometer to deep breathe and to cough. Shortly after you return to your room, after surgery, your doctor will probably advise that you get out of bed as soon as possible. Some patients are surprised at how soon after surgery they're encouraged to get out of bed and move around. Movement increases the blood flow and decreases the chance for blood clots and for pneumonia. Studies have also shown that the longer someone stays in bed, the weaker the body becomes and recovery may take longer. If you do not feel like moving because you hurt, ask for your pain medicine. Moving around will decrease your pain level by working out the stiffness and soreness. After surgery, unless your doctor tells you to stay in bed, we expect you to do the following. Move your arms and legs often while you're in the bed or chair. Sit in a chair 3 to 4 times a day. Walk as much as you can with help from nursing staff or your family. And set a goal to walk further each time you walk. The nursing staff will show you how to get in and out of bed safely and how to walk with tubes and equipment. When you begin to move, remember these helpful hints. Do not get up by yourself the first 1 or 2 times. Your medicines may make you drowsy, and we do not want you to fall. Also, you may be weaker than you think. Always use your nurse call bell to get one of the nursing staff to help you. Make sure you know where your tubes are before you get up. These may include IV lines, oxygen tubing, surgical drains, or a Foley catheter to drain urine. Sit on the edge of your bed by rolling to your most comfortable side first. Then allow your legs to lower over the edge of the bed as you push into the bed with your arms to raise your upper body. If you have an incision in your chest, your nursing staff will show you how to do this. When you stand, push from the bed or chair with your arms. Do not pull on the nurses or your family member. If you have an incision in your chest, your doctor or nurse may tell you not to push on your arms. You may need to cross your arms over your chest, then lean forward a little while standing. When you sit, reach back for the chair or bed with your hands unless you have been told not to push with your arms. In this case, you may need help to sit after you cross your arms on your chest. If you feel unsteady while you are walking, hold someone's hand or arm for support. If you have trouble moving, your doctor may ask a physical therapist or occupational therapist to help you. The therapist will teach you how to move safely on your own. If you need equipment such as a walker or cane, the therapist will show you how to use these devices properly. Throughout your hospital stay, remember that your participation is a key part of your recovery. We are here to help you, but the more you take part in your care and follow your doctor, nurse, or other healthcare worker's advice, the quicker you will heal and be on your way to recovery. Thank you for choosing Wake Forest University Baptist Medical Center for your surgery. Please let us know if you have any questions or concerns or do not understand the information we give you. Always ask us to explain words or phrases that you do not understand. We want to ensure your comfort, satisfaction, and the best possible result from your surgery.